Hi, IHFRA. I am Tish Zitzow. I have been working with the IHFRA Association members since 2020, that horrible year that we all know about. Well, for 2024, we have spent some significant amount of time to find you guys programs that are guaranteed issue no matter where you live in the country. That is a PPO that allows you to see doctors when you're on the road, because we all know how important that is. If you have an HMO, if you have an income-based plan that is guaranteed or subsidized by the government, sometimes those are HMOs. Like in the state of Texas where I live, that means that you have one doctor that decides if you're sick or hurt enough. So that's what happens with a lot of those government plans. If that is your situation and you do qualify for significant cost reductions on the marketplace, there are ways that we can add some of these supplements that we're going to talk about as well to your existing plan, so you have coverage out of state if you are eligible to make those subsidies and get those plans. Because when you're going to see the pricing here, this pricing is for everyone, no matter your age, no matter your income, no matter where you live. So it's across the board, which means that in a lot of cases, especially in our younger folks in the South, well, that's kind of the least expensive people in the country, this might not be the best plan for them. But if they have health issues, again, a guaranteed issue private policy is fantastic. This is considered a group product, which is why we run it through IHFRA, although you will pay for it directly with your own credit card or bank information. It is a group product. So let's just go ahead and get into it. Okay, so next slide, if I'm smart enough to make this work. Our next slide is going to talk about, guess what? We've got some name brands here that I think you're going to be pretty happy with. Our guaranteed issue health insurance is from Nationwide. It's called the Vault, and we'll go over it in greater detail in just a moment. Manhattan Life gives us our guaranteed issue supplement. So what's a supplement? That's what helps cover your out-of-pocket expenses. An indemnity plan I'm going to talk about quite a bit here. An indemnity plan is going to, if it makes any sense to you, think about it like an AFLAC plan. An indemnity plan is going to pay in addition to your health plan, but it's going to pay a flat sum. So it's going to help fill in some of the gaps on the main health plan. So I encourage highly that we bundle. No, I'm not Flo from Progressive, guys. We're not talking about your home and auto. We're talking about a health plan with an indemnity plan to make sure that you have the coverage that you need. Colonial Life has been around even longer before than me. However, I do now help manage that account. We are still using them where they have guaranteed issue disability plans and guaranteed issue life insurance plans. So again, I just wanted you to kind of see the name brands we're talking about. We're not talking about some fly-by-night companies. Nationwide offers something called the Vault. The Vault is a health insurance group product available to everyone in the association. As you can see, there are two plans. There is a basic plan and there is a pro plan. Oh, and just real quick, if you are Medicare age 65 and up, 64 and a half, you're about to turn that way, or you're on disability, we do have a dedicated Medicare person for the furniture industry. Her name's Laura Snyder. Her number's at the top, but you can always reach out to us and I'll get you right to Laura immediately. She did come to market, so she got to experience that. So we're super excited to have her on the team. Anyway, back to the under 65 group. The basic plan has a small deductible and has a higher max out of pocket. The pro plan has a zero deductible with a lower max out of pocket. Obviously, the pricing is going to show the difference. I do want you to notice a few of the limitations. You can see your primary care anytime you want to, however often you want to, for $20 copay or $10 copay. However, when you start getting into specialists, labs, imaging, etc., there are some limitations. So that is why I keep talking about that bundling thing, because if we add the indemnity plan, and whenever you ask for a quote, you're always going to see that piece on there. When you add an indemnity plan, it's going to help fill in these gaps where you have limitations, which is why we're able to get guaranteed issue, because we've split the risk between two carriers, between Nationwide and Manhattan. So it's allowed us to ensure that we've got good coverage, but you've got, the additional pieces. I have a lot of people tell me, I'm healthy, I'm fine with the basic, I don't need any extra. That's your decision. Again, every piece of any part of IHFRA is, it's a la carte. We can do however we want to. But again, the plans work the best when they are bundled. Our next piece of the puzzle is pricing, right? You're going to want to talk about pricing. So here's our 2024 pricing. These are the bundle price that include that indemnity, again, that piece that kind of fills in the gap, and an additional accident claim. If you're like, Tish, no, I'm good, I don't need the extra pieces, here are the basic prices for 2024. And I think there's like a couple of dollars service fee if you choose to do credit card. So make sure you pay attention to that, because that's a processing fee. It doesn't have anything to do with us. It's just how you're paying. So your best bet is going to be by bank draft because you won't have that additional fee. That being said, again, the bundling is always going to be the best pricing. We will reach this by going here. Don't worry, I'm going to go over that in just a moment as well. But I did want you to see that these are the bundled prices. These are the prices individually. So you're not paying a lot for the additional coverage. Supplemental coverage, again, that Manhattan Life is where we're getting, indemnity, accident. But critical illness, vision, and dental are age and tobacco based. And because they're age and tobacco based, I can't just put every age and every rate up here on the screen. It would take us forever for us to do a line item, go over that. So if you need those additional pieces, you can get them in your portal once you create a profile and you create your date of birth and all that information, and it'll give you a customized quote. I can do it as well if you want to reach out to us, because that's what we're here for as well. The additional pricing available for short-term disability and guaranteed life through Colonial. Also, age, location, and tobacco-based pricing. They have such an intricate way of putting all of the pricing and making sure they get the right amount of disability and the right amount of life insurance for you. Again, they're both guaranteed issue, but they will make sure that it works for you. Therefore, I can't do the pricing. They use their own in-house reps. I'm still here to help you with it, but I can't give you pricing. So you will need to reach out to Colonial Life directly. And again, I'll give you that in just a moment. So when bundled, I've said it so many times, and I'm going to really reemphasize it. When bundled, you get 2 PPO networks. So there are 2 major private health insurance product PPOs in the country. Blue Cross, United, Cigna, Humana, Aetna, they're called the BUCAs. The BUCAs, they all have major buying power because we all know their names, right? Well, you have some of these behind the scenes because Nationwide isn't really known for health, right? They are known for home and auto. So you have all of these other carriers that are trying to come in and have that same buying power as Blue Cross and United. And when they do that, they kind of pull their money together. They pull their buying power together. So how do they pull it? They pull it by either using PHCS, which stands for Private Healthcare Systems, or they use First Health, which is an Aetna PPO, an Aetna rebranded PPO for the private market. So there's kind of a differentiation. So when bundled, you get both. The main Nationwide plan works on the PHCS system, and Manhattan works on the First Health Aetna system. So in all of these cases, guys, you can have multiple carriers. But if you just go with Nationwide, you have this. If you just come and get some supplemental coverage to cover what you do have already that's income based, that's going to be First Health. So whatever your network is at home, you'll use that, and this can be your supplement. So you'll have a primary and secondary. If you need to do something of that nature, let's make sure we get on the phone. My number and contact information will be here at the end, but make sure let's talk about it so that you do have coverage. I don't want you guys signing up thinking you have the right fit, because that's kind of what we do. I really want to focus with you guys on the furniture industry and make sure we're finding the right fit, especially where you travel. Traveling is a big deal for you guys. So let's just make sure that we've put you on the right kind of plan. And guys, I can help you with your income-based plans. We can do the comparison, and I'm happy to talk through that with you as well. So now what? We have 2 different websites. One, this is going to be for your health. This is going to be Nationwide and Manhattan. And then obviously Colonial Life is going to be for your life insurance and disability. So to click over here real quick, here's what your portal is going to look like. I'm already logged in. Otherwise, it would say get started. But once you come in here, I'll be able to do all my enrollments however I need to. But let's talk about this. Each of these little tiles, if you click on it, you're going to actually be able to get, hey, that thing I already looked at that I already showed you that shows those plans. Okay, so it's going to give you a little bit more information. If you come over here and click on this tile, and we talked about indemnity, dental, vision, all those pieces. Also, clicking on that tile, you can get the full PDF tells you a little bit about Manhattan. They are not from New York City, by the way. They're out of Houston. And it shows you about the accident plans, kind of how they work. Again, think Aflac pays a certain amount for however much you have. So that's what the accident plan is. And it gives you some additional accidental death insurance as well. So those are available to you, those actual brochures, on the portal at ifra.zivowbenefits.com. And the other piece of it is Colonial Life. So Colonial Life is that these links are available on IHFRA's site, but they're also available by me, through me, however you want to. But this is where you're going to come in and you're going to be able to connect with our dedicated rep there at, oops, sorry, that went to mine. Sorry about that. Our dedicated rep at Colonial Life, and that's going to be Gabriel Holguin, and they can help you get enrolled with the right plan for what it is that you need. So that kind of tells a lot of the story. Here's the real big deal. If you have questions, call me. You can enroll in these plans 24/7, 365. They do not require a special enrollment period. So if you're listening to this or watching this in the middle of the year, it doesn't matter if you have a special enrollment period. If you're just not happy with what you have and you want to move over, there are all kinds of things we can do. These are PPO plans. Again, guaranteed issue no matter what your health conditions are. There are 12-month waiting periods for certain conditions. So let's make sure we talk through those as well to make sure, again, that this is the best fit for you. Because if it's not, we have many, many other programs that we can talk about. So my number, 936-449-0454. Come visit us, americashealthcareexperts.com. Thanks so much for your time. And I really hope you guys have a fantastic year.